Insulin costs about $3 to manufacture. In America, patients pay up to $300 for the same vial. The markup isn't coming from the drug company alone. It's coming from a middleman you've probably never heard of, a pharmacy benefit manager. 3 companies control nearly 80% of all prescription drug transactions in the United States. This is how they work, and why your medications cost so much. A pharmacy benefit manager, or PBM, sits between your insurance company, your pharmacy, and the drug manufacturer. When your doctor writes a prescription, the PBM decides which drugs your insurance will cover, how much you'll pay at the counter, and how much the pharmacy gets reimbursed. They negotiate drug prices, manage formularies, and process claims. On the surface, they're supposed to reduce costs. In practice, they've become the most powerful players in the entire pharmaceutical supply chain. Here's where the money flows. Drug manufacturers pay PBMs billions of dollars in rebates to get their drugs on the formulary, the list of covered medications. The higher the list price, the bigger the rebate. PBMs keep a significant portion of those rebates as profit. In theory, rebates should lower costs for patients. In practice, the rebate system incentivizes higher list prices, because higher prices mean bigger rebate checks. The patient pays a copay based on the inflated list price. The PBM pockets the rebate, the system rewards expensive drugs. Spread pricing is one of the most controversial PBM practices. The PBM charges your insurance plan one price for a drug, say $50. Then they reimburse the pharmacy $30. The $20 spread goes to the PBM as profit. Neither the insurance company nor the patient sees the actual acquisition cost. Several states have begun banning spread pricing in Medicaid contracts, but it remains widespread in commercial insurance. The PBM profits on the gap between what they charge and what they pay. And nobody else at the table knows the real numbers. The 3 largest PBMs, CVS Caremark, Express Scripts, and OptumRx, are each owned by a parent company that also owns an insurance company and a pharmacy chain or mail-order pharmacy. CVS Caremark is owned by CVS Health, which also owns Aetna Insurance and CVS Pharmacy. Express Scripts is owned by Cigna. OptumRx is owned by United Health Group, which also owns United Healthcare. They decide which drugs are covered, set the reimbursement rates for pharmacies, and then steer patients to their own pharmacies, which they reimburse at higher rates. Independent pharmacies say they're being driven out of business by reimbursement rates set below their acquisition costs. Insulin is the clearest example of PBM distortion. The drug has been around for over a century. Manufacturing costs are low. Yet, list prices climbed for years, driven in part by the rebate system. Manufacturers raised prices, PBMs collected larger rebates, and patients with high deductible plans or no insurance paid the full inflated price. People rationed insulin. People died. In 2023, major manufacturers finally capped out-of-pocket costs at $35. But the underlying system that inflated the price in the first place hasn't fundamentally changed. In 2024, the Federal Trade Commission released a report on PBMs after a multi-year investigation. The report found that the big 3 PBMs use their market dominance to inflate drug costs, squeeze independent pharmacies, and create conflicts of interest through vertical integration. The FTC called the rebate system perverse, rewarding higher list prices instead of lower ones. Bipartisan legislation has been introduced in Congress to increase transparency and regulate PBM practices, but as of now, no comprehensive federal PBM reform has been signed into law. There are ways to reduce PBM impact on your costs. First, ask your pharmacy for the cash price. It's sometimes lower than your insurance copay. Second, use discount programs like GoodRx or Mark Cuban's Cost Plus Drugs, which bypass PBM pricing entirely. Third, if you're on a high-deductible plan, compare prices across pharmacies. The variation can be enormous. Fourth, ask your doctor about therapeutic alternatives that may be on a lower formulary tier. And fifth, support independent pharmacies when you can. They're often more transparent about pricing. 3 companies process nearly 80% of all prescriptions in America. They negotiate in secret, profit from complexity, and own the pharmacies they're supposed to be regulating. The system wasn't designed for patients. It was designed for margin. And until transparency is mandated, the people paying the highest price will be the ones who can least afford it.